this episode, I am going to concentrate on the good, the bad, and the ugly among the fats that we take. We should know what is good, which fats is good for the system. We should know which fat can cause harm to the system and which fat is worse to the system, which cannot be taken at any point of time. So, good, bad, and ugly of fat. Here, in one word, the good is all unsaturated fats are good, whether it is monounsaturated or polyunsaturated fatty acids. Then the bad is the saturated fats, and the ugly is the trans fats or trans fatty acids. What is the source for unsaturated fat? What is the source for saturated fat? What is the source for trans fat? The unsaturated fat or unsaturated fatty acid means there is one or more double bond among the carbon atom in the fatty acid chain. Chemically, they are classified as unsaturated fatty acids. Unsaturated fatty acids are usually present in all vegetable oils except coconut oil and palm oil. Coconut oil and palm oil are rich in saturated fatty acids. All vegetable oils except that. Say the common oils that we use, the safflower oil, sunflower oil in the seeds such as groundnut, sesame, mustard. Then oil in seeds such as flax seeds, fenugreek seeds, rice bran oil. All these oils are rich in unsaturated fatty acids which are heart healthy. They are healthy to the heart. Also the fish oils, especially the cod liver oil and sardine oil, they are heart healthy. Olive oil is heart healthy. Also the invisible fats that are present in the green leafy vegetables, peas, legumes, avocados, all these things are rich in unsaturated fatty acids and they are heart healthy, especially spinach. The fat that is stored in green leafy vegetable spinach is rich in unsaturated fatty acid and it is heart healthy. These are very good fat because they lower the LDL cholesterol level or the bad cholesterol level in the system. So they prevent atherosclerotic coronary vascular disease. So this is the good among the fat that we consume. That is the unsaturated fatty acid present in vegetable oil. Now, what is the bad among the fat that we consume is mostly present in animal food such as raw red meat is rich in saturated fat. Then the fat that is present in animal products such as cheese, butter, milk, cream, all these are rich in saturated fats and they are usually solid at room temperature and they are bad because they elevate the LDL level or bad cholesterol. Then also the coconut and palm oil, though they are vegetable oils, they are rich in saturated fatty acid and so they are considered bad among the fat that we consume. So the bad fat is mostly of animal source. Then the good fat is mostly of vegetable source. Then third, the ugly, which is even more disturbing. It is nothing but an artificial or industrial source where the unsaturated fatty acid is partially hydrogenated to produce what is called vanaspati or dalda. This fat is rich in trans fatty acid and this trans fatty acid is supposed to be ugly to the heart because it not only elevates the LDL-C level, it also decreases the HDL level which is called good cholesterol. This is mostly used in food industry to produce packaged foods. So avoid deep fried foods. Food that is present in the bakery food such as packaged cookies, packaged donuts, packaged chips, packaged crackers, energy bars, the whipped toppings, the cream around the cakes, all these things, pastries are rich in trans fats. The trans fat should be less than 1%, but nowadays we consume more. This excess consumption of trans fat is supposed to be ugly or worse to the heart, because it increases LDL-C and also decreases HDL level. So decrease or restrict the trans fat intake less than 1%, restrict the saturated fat intake to less than 6% of the calorie intake. You should be lesser than that. Increase the unsaturated fatty acid intake, which is rich in vegetable oils and fish oils. Thank you. Thank you. In this episode, I am going to focus on the low density lipoprotein or the bad cholesterol. First, just to brush our memory, the main source of energy for cells after food intake is glucose. Whereas in between meals or during starvation, it is the fatty acid that acts as the main source of energy. These fatty acids are synthesized in the liver, and they are carried as VLDL, very low density lipoproteins, to the periphery along with the apoprotein B, cholesterol esters, phospholipids and vitamin E. Once they are secreted by the liver into the plasma, the VLDL is acted on by lipoprotein lipase enzyme present in the endothelium, from which fatty acids are released, and these fatty acids are taken up by the peripheral cells for energy. So the primary function of VLDL is to transport fatty acids in the form of triglycerides from the liver to the peripheral cells. Once VLDL releases the fatty acids, it derived from VLDL is a byproduct called LDL. It is a byproduct of fatty acid energy release from VLDL. So low density lipoprotein or LDL cholesterol is a bad cholesterol. It doesn't have much physiological role. It is desirable to have this LDL cholesterol less than 100 milligrams per deciliter. And once it is elevated more than 120 milligrams per deciliter in plasma, it is harmful. What it does is, it goes to the subendothelium. It is taken up by the macrophages, and the macrophages which are engorged with this LDL cholesterol become what is called foam cells. These foam cells get deposited in the subendothelium, which is the triggering mechanism for atherosclerosis or deposition of lipids in the intima of the blood vessel. So, which is the first stage of atherosclerosis. So, this excess LDL leads on to atherosclerosis, and it has a lot of physical signs by which we can identify the person has elevated LDL level and has an elevated total cholesterol level. Number one is because of the waxy LDL substance moving in circulation, the person has extreme fatigability. He has myalgia, especially leg pain after walking for some distance. Can also have discoloration of skin in the lower limbs. Then it manifests physically as arcus senilis, a bluish ring-shaped structure around the cornea. It can manifest as tendon xanthomas, which are elevated bumpy substances that are seen especially in the tendons around the dorsum of hand. It can manifest as xanthelisma, which is an yellowish papule-like lesion present around the eyelids. So these are the physical signs that a person can have an elevated LDL cholesterol level. The person is hypercholesterolemic, so he needs attention. So with this knowledge of signs and symptoms, observe this, whether you have increased fatigability, cramp in the legs often, leg pain, discoloration, physical signs of arcus senilis, tendon xanthomas, xanthelisma, immediately get your lipid level checked. If the lipids level shows an elevated LDL level of more than or equal to 100 milligrams per deciliter, then pay attention. Otherwise, it can lead on to atherosclerosis later on. So, avoid missing these clinical signs. Act early. Thank you. In this episode, I am going to focus on another parameter which is a significant indicator of myocardial infarction, or a person is prone for myocardial infarction, is lipoprotein A, a level called lipoprotein A. Earlier, LDL level was found to be significant, then a low HDL level was found to be significant, an increased total cholesterol level was found to be significant, an increased triglyceride level was found to be significant. Now, this important parameter, lipoprotein A, as a more significant indicator of an ischemic heart disease or coronary heart disease. It is also called the little rascal. Before going on to lipoprotein A, I would like to focus on what prevents an intravascular thrombosis normally, not prevents a blood clot from extending to a place other than where it is required. As you all know, a clotting mechanism is an inherent protecting mechanism in the system against continuous bleeding. To arrest bleeding, this clotting mechanism is helpful. It is activated once the blood vessel is injured, the endothelium is exposed, platelets come and plug the leak, and added to that, clotting factors also act and they form a clot, a fibrous clot, which is solidified and arrests the bleeding. If this clot extends, or if there is an intravascular clot that is formed, it is called thrombus or embolism, which can lead to coronary heart disease or ischemic heart disease. So, this is prevented normally by, number one, the smoothness of the vessel wall. The endothelium is smooth always, so it prevents intravascular thrombosis. Number two, the shearing force created by the force of well prevents the clot from extending. Number three, the presence of anticoagulants, naturally occurring anticoagulants such as protein C, also prevents the spontaneous intravascular clot. Then number four, the presence of a system called fibrinolytic system, which is activated by plasmin, which is derived from an inactive precursor called plasminogen. Plasminogen is activated to plasmin, and this plasmin forms a fibrinolytic system. This fibrinolytic system prevents the extension of the clot from the site of injury. Only the clot is restricted to the site of injury, and because of fibrinolytic system, it doesn't extend beyond. Now come to our little rascal lipoprotein A. This lipoprotein A has a homology similar to plasminogen. So it mimics plasminogen. It competes with plasminogen. So it prevents the activation of fibrinolytic system by plasminogen. So the clot enhances. So spontaneous intravascular clot formation is more, thrombus formation is more in a person who has a genetically prone increased lipoprotein A level. So when there is increased lipoprotein A level, especially in Indians, they are prone for spontaneous intravascular thrombosis, which can lead to coronary heart disease. Normally, in 40% of individuals, the lipoprotein A level is untraceable. If at all it is present, it is only between 0 to 3 milligrams per deciliter. If 20% of individuals in Indians, the lipoprotein A level is more than or equal to 30 milligrams per deciliter, which is a high risk factor, and it is an indicator of future atherosclerotic coronary vascular disease. So, an elevated lipoprotein level is a significant indicator or risk factor for future coronary heart disease or coronary vascular disease. Hence, estimation of lipoprotein A level is very, very important in you test for lipid profile. And if you watch the level of more than or equal to 30 milligram per deciliter, an immediate consultation of cardiologist and further workout is essential. Thank you. In this episode, I am going to focus on the good cholesterol, that is HDL cholesterol, high density lipoprotein. It is called good cholesterol or healthy cholesterol. H stands for healthy because it is helpful in removing the excess cholesterol from the system. It is called reverse cholesterol transport. LDL transports fat in the form of triglycerides from the liver to the peripheral tissue, whereas HDL, high density lipoprotein, does the reverse. It transports fatty acid from the peripheral cells to the liver to be excreted. I have already discussed that the primary route of excretion of fatty acid from the system is via liver and enterocytes, and liver does it mostly by forming bile acids, and HDL cholesterol favors excess cholesterol removal by transporting, reverse transport of fatty acids from the peripheral tissues back to the liver, and the liver does this by forming bile acids. So thus HDL is cardioprotective, anti-atherogenic, very, very helpful in reducing the bad cholesterol. Also, the HDL fatty acid transport to the liver prior to that has to be esterified with polyunsaturated fatty acid. Polyunsaturated fatty acid acts synergistically, and it is supposed to be very good for the health. The normal HDL level, it is desirable to have more than or equal to 50 milligrams per deciliter. Less than or equal to 30 milligrams per deciliter is supposed to be harmful to the heart. So we should know the ways and means by which the HDL level can be maintained or increased. There is not much of dietary source to elevate HDL level. HDL level can be elevated by indulging in regular aerobic physical activity of at least 150 minutes per week. Exercise is the major contributor for elevation of HDL level. Genetically, we Indians have a lesser HDL level compared to Westerners. That is why we are more prone for myocardial infarction. So, we physicians advise the patients with the dyslipidemia to involve in moderate aerobic activity so that they can improve their cardioprotective HDL levels to more than or equal to 40 milligrams per deciliter, so that atherogenosis is prevented. Next, HDL level can also be elevated to some extent by consumption of almonds or nuts. Nuts like almonds is very, very helpful, but not to the same extent as aerobic exercise. Aerobic exercise is very, very beneficial. Next is almonds or nuts. Then vitamin niacin is essential or is helpful to elevate the HDL level. Then fiber-rich berries are helpful to elevate the HDL level. Flax seeds and fenugreek seeds, which are fiber rich, are also very, very helpful to elevate the HDL level. So HDL level is very, very significant along with the LDL level in determining whether the person is dyslipidemic or not. An elevated HDL level of more than or equal to 40 milligrams per deciliter is very, very essential. Thank you. In this episode, I am going to focus on the heart healthy benefits of omega-3 fatty acids. Omega-3 fatty acids are supposed to be very, very beneficial to the heart. They are prophylactic against coronary heart disease. They are mostly present in cold water fish such as salmon and tuna. They are present in walnuts, flax seeds, wheat germ, etc. This omega-3 fatty acid is protective to the heart in various ways. The primary function of omega-3 fatty acid is to reduce the triglyceride level. If the triglyceride level is more than or equal to 500 milligrams per deciliter, even if the LDL level is lesser, the person is prone for atherosclerotic coronavascular disease. So, by decreasing the triglyceride level, omega-3 fatty acid is supposed to be heart healthy. Number two, omega-3 fatty acid also maintains the integrity and healthiness of endothelium. It is the injury to the endothelium that acts as the trigger for thrombovascular events. So once the smoothness and integrity of the endothelium is protected, then the chances of atherosclerosis, superadded thrombosis are lesser, and thus a person is protected from coronary vascular disease. Also, omega-3 fatty acid maintains the fluidity of blood. The very essential feature of blood is to maintain its fluidity, to keep circulating, which is lost in the case of hypertriglyceridemia, where the blood becomes waxy and it is milk-like. The flow becomes turbulent and the blood is more thrombotic. It has a tendency to form thrombosis and thus develop coronary heart disease. So, this omega-3 fatty acid, thus by maintaining the fluidity of blood, prevents turbulence, prevents thrombotic tendencies. Also, omega-3 fatty acid is helpful in checking the blood pressure, keeping it within normal limits. And omega-3 fatty acid also is helpful in preventing the occurrence of arrhythmias or altered heart rhythms. And omega-3 fatty acid is also essential for preventing inflammation of the endothelium, which also can act as a trigger for atherosclerotic coronary vascular disease. So thus, to prevent coronary heart disease, to prevent heart attacks, it is my advice, take more of fish foods, especially salmon and tuna, which are rich in omega-3 fatty acid. In case of vegetarians, take more of nuts and seeds, which are rich in omega-3 fatty acid, because omega-3 fatty acid is heart healthy. Thank you.